An estimated 2.7 to 6.1 million people in the United States have AFib. With the aging of the U.S. population, this number is expected to increase. Approximately 2% of people younger than 65 have AFib, or AF, which is a quivering or irregular heartbeat arrhythmia that can lead to blood clots, stroke, heart failure, or other heart-related complications. Dr. Arthur Kendig is a cardiac electrophysiologist at the Heart and Vascular Center at the Southeast Alabama Medical Center. Dr. Kendig discusses AFib during this Heart Health Awareness Month.
So atrial fibrillation is basically an abnormal heart rhythm that comes from the top of the heart called the atrium, normally from the left to top part of the heart called left atrium. Essentially, instead of the heart having a nice normal rhythm where the top beats and the bottom beats kind of, back and forth, this is a very chaotic rhythm where the top of the heart almost quivers, almost an electrical storm of sorts, so it can go up to about 300 to 400 beats a minute. Luckily, there's a little wire that connects the top and the bottom that doesn't let all those beats come through in most cases, but can still make your heart rate very regular and also very fast, in some cases up to 200 beats a minute or so. There's some statistics that show that atrial fibrillation patients have 5 times greater risk of stroke than the general population. And that's because with the top of the heart kind of quivering there's little pouches that kind of come off of there. One's called the appendage, where clots can form because the heart's not pumping blood effectively. Basically, if you think about blood sitting around, it's not pumping, it can actually form little clots. And those clots can then kind of dislodge or break off and potentially get to the brain and cause strokes or other types of blood clots that travel to the rest of the body. It's actually very treatable. There's a whole lot of options nowadays for it. In terms of the stroke risk prevention, most people need to take some type of blood thinner, at least aspirin, or some of the newer medications such as Coumadin or some of the other ones that are out there. In terms of the heart rate itself, you don't want to go too fast, because if the heart goes too fast for too long, you can get tired out. Just as if you try to run a race and go too long, you'll eventually get tired out. So a lot of times you have to put people on medications to control the heart rate. Beyond that, for symptoms, people can be normal heart rate but have symptoms from being irregular in terms of the rhythm. So we will try people on rhythm drugs as well. And then one of the options, which is why I was brought here, to do what are called ablation procedures. And that's if the medications fail and people still have symptoms, we can actually go into the heart via the veins in the groin or the legs there, go into the heart itself and either burn or freeze the abnormal areas in the top of the heart where the AFib is coming from. It's actually pretty common. About 2.7 to 3 million Americans actually have it, and the number will probably get greater over the next number of years as we have an aging population and also have better ways of detecting it as well. Our area has a pretty good proportion of atrial fibrillation patients, and one reason is this area and also other areas in the country, you've got a lot of folks who have risk factors for developing atrial fibrillation. So hypertension or high blood pressure, coronary artery disease, diabetes, cholesterol can maybe play a little bit into it as well. Sleep apnea, so all these things are risk factors for developing atrial fibrillation. So we got a pretty good number of patients in the area who either have it or are kind of yet to be found.
I'm Deborah Pearson reporting.